Hi, my name is Brittany King, and my meta-analysis is on the use of vitamin B, vitamin D, and omega-3 fatty acids and depression. Depression is a growing health concern for multiple reasons. For starters, in 2012, authors from the World Health Organization found that 350 million adults worldwide were suffering from depression. It is the most common cause of sick days and leave of absences at the workplace in the United States currently, costing $34 billion in lost work annually. Other research has also found an increase in depression that is affecting health status and the workplace. In 1999, 10.1 million adults visited a doctor or received a medical prescription for depression management. By 2009, that number increased to 17.6 million. Also in 1999, $18 billion were spent on treatment for depression, and in 2009 that number grew to 22.8 billion. Lastly, all of these increases in depression present a problem because depression has been found to be a risk factor for some cancers, heart disease, and hypertension. The purpose of my research is to determine if there is a relationship between depression management or prevention and some nutrition concentrations. My research will focus specifically on the concentrations of vitamin B, vitamin D, and omega-3 fatty acids that are being consumed. The research will also look to determine what levels of each of these components are necessary to have an impact on depression, as well as other confounding variables, including medications already being taken to manage depression, sex, age, and race. The outcome of my research is significant because, as previously discussed, depression is growing in prevalence worldwide. Current medications that are used to treat depression are expensive and come with unwanted side effects, including blurred vision, weight gain, and gastrointestinal problems. If a positive relationship is found between the consumption of vitamin D, vitamin B, and omega-3 fatty acids, this could prevent further increases in prevalence of the disorder, help those with depression manage their disorder more affordably, and prevent unwanted side effects. The research question associated with my meta-analysis is there an association between the inclusion of vitamins B, D, and omega-3 fatty acids in an individual's diet and their experience of the symptoms associated with depression? The null hypothesis is there is no association between the inclusion of vitamins B, D, and omega-3 fatty acids in an individual's diet and their experience of the symptoms associated with depression. The alternative hypothesis is that there is an association between the inclusion of vitamins B, D, and omega-3 fatty acids in an individual's diet and their experience of the symptoms associated with depression. MetaEasy software will be used to produce the data for my research. It will come from the composition of multiple individual studies. The variables assessed within those studies will be the consumption of vitamin B, vitamin D, and omega-3 fatty acids, and at what level those components are being consumed. The measured effects of the individual studies will be the effect that the nutrition components have on depression prevention and symptom management.